Good morning, good afternoon, good evening, wherever you are in the world. Today, we are going to be talking to Dr. Hakim in Dubai. Hello. We're talking about lens replacement. Now, presbyopia is a thing that happens to, we're going to find out if it happens to everybody, but it is an age-degenerative issue, which starts, I think, in your late 40s. But Dr. Hakim will be able to tell us all about it. I recently had my my eye lenses replaced by him. And now I can see. There he is.
Finally.
Amazing. Thank you. Right, please, first of all, Dr. Hakim, can you tell me the difference between laser? Can you hear me?
Yes, I can hear you clearly. Yeah.
Can you hear me?
Hear.
Okay.
Yes, I do.
Laser and what I had done.
So there's a difference between laser vision correction and lens replacement. I can show you this like very quick. The eye, the anatomy of the eye. So we do have the cornea here, which covers the front of the eye. And here we do perform the laser vision correction. It could be PRK or SMILE or femtolaser. So what we do is we reshape the cornea to correct the vision. But this lens replacement, we do have the lens which is sitting inside the eye. So what we do here is we remove the lens and replace it with a new lens, with intraocular lens. It's like kind of cataract surgery. It's similar to cataract surgery. So there is a difference. So we do use laser vision correction if patients are wearing glasses for far distance. And the range of age for me, myself, is between 21 and let's say mid-50s if they are wearing glasses for far distance. So we can fix the far and like kind of the near distance. But if we have patients who have only near distance vision problem, like only wearing reading glasses, so it's very difficult to correct it with the vision, and it's much easier to do for lens replacements like we did in your case.
Right. And why I thought eyes bled. Why isn't it messy?
I mean, it's like, you're talking about reading glasses, yeah?
No, when you operated on me and I felt sort of semi-aware, my vision in my head is that it's going to be painful and blood.
Yeah, no, there's no blood in ophthalmology, let's say in this kind of surgeries, or very minor. But it's not painful because we do have two different types of anesthesia. One of them is the local anesthesia, like we did in your case. We give a patient like a tablet just to relax, for relaxation, and we numb the eye very well with eye drops. It's like similar when you go to the dentist, you feel your teeth is numb, you feel like somebody is doing something here, but you don't feel the pain. So it's the same in the eye.
Right. And how long does it last for?
The surgery, it takes, with the surgery itself, we need like 15 minutes.
Right.
But the preparation for the surgery takes up to 1 hour because we need to admit the patient, we need to give him drops to numb the eye, dilate the pupil, and get the patient in the operating theater. This takes more time than the surgery itself.
Right.
But normally 15, 20 minutes the surgery is done. So normally we do one eye, and a week later or 3 days later we do the second eye.
And then after the surgery, how long does it take for the full impact of the new lens?
So we do say that the neuroadaptation time until the brain get used to this lens and the function of the lens, the impact is very quick, honestly. Within 2 weeks or 1 week, you will feel the difference. But until we get to the stability, because the lens needs to get stable inside the eye after we perform the surgery. So it takes up to 6 weeks to 12 weeks until we say, okay, now everything is settled. The healing process is completely done. So we can talk about stability after like 6 to 12 weeks. But the impact, the feeling that the vision has improved, it should be within 1 or 2 weeks.
Yeah, or even 1 or 2 hours in my case. Like, I think I can see. I think I can actually see. Somebody is asking, why not both at once?
Because we want, first of all, is like sending the patient out of the surgery with two like eye patches is not convenient for the patient. This is number one. Number two, in case of anything happen to the eye, we don't want the patient to do both eyes at the same time. It's gonna take longer for the patient, and most important for us as surgeons, we want to make sure that the power we have chosen for the intraocular lens to be implanted in the eye is 100% correct, and to check what is the refractive after 2-3 days. So in order to choose the exact power for the second eye. So it's like just kind of give you a better feeling.
Yeah, because I think you had the choice of 3 lenses for my second eye, and then you were umming and
3
ahhing
different
which
powers,
one.
let's say, which exact power. We want to get, let's say, we want to match the best correction for the eye. So sometimes there is a minor difference between the power of the lens. It could have an impact on the vision. So we want to make sure that the second eye has, let's say, the best choice as well.
Right. Different options of lenses.
Yes. So we do have, generally speaking, we do have the monofocal lenses, which is only considered for the far distance. So these lenses, we use it mainly for cataract surgery for elderly people who they want to have good vision at the far distance, and they don't mind wearing like computer glasses or reading glasses. So the second one is the EDOF lenses, which stands for extended depth of focus, which give you an excellent far distance, very good intermediate, let's say, and like reasonable reading distance. So this lens is chosen for the patient who wants to have more intermediate, more sport activity, far distance, and they care less about reading and fine work. So the third option, the multifocal lens, which give you like better option than the EDOF in the near distance, and this is like meant for the patient who say, I read a lot. My main problem is reading distance. So then we can go for the multifocal lens. So it's very important just to talk to the patient and ask them about their hobbies, the occupation, what they do, what is important for them. It's like playing like tennis is different than playing like golf, because golf you use the far distance, tennis you just hit the ball which gets like to the intermediate distance. So these like questions are very, very important for us and for the patient to be asked.
Right. Okay. And what age? This is presbyopia is an age degenerative issue. What age does it generally start?
It's normally the presbyopia. It normally start with above the age of 40. So it's
Right.
like
You said it started with you, right?
yeah, I'm mid 40. It started now. I feel like in the morning I feel like okay. So I will end up having my reading glasses, of course. But I had LASIK done 17 years back, so it's not possible for me to do laser again to correct my near distance. So I have to accept, like temporarily, the reading glasses, and then we'll talk about the lenses. But it's like affect the patient above the age of 40. It's the easiest explanation is I tell the patient it's like, you know, the old cameras, the Canon or the Kodak one, where you have to zoom in and zoom out in order to capture the best clarity of a photo. So with time, this function, we call the accommodation function, will get weaker. So like zooming in, zooming out, we get weaker and weaker until we cannot focus at near distance when the lens reaches its maximum. So then we can correct it with reading glasses or like surgery.
Right.
So it's normal aging issue.
I feel so lucky that this is possible. Really, I'm just every day. I am so grateful. I'm so happy to be able to see without glasses. Oh,
I'm glad to hear that.
Life-changing. Can anything be done about congenital cataracts?
It's a different situation. Congenital cataract, it means that babies are born with having lens opacity or cataract. So we have to operate the kids, like let's say within weeks after delivery, because the impact of the cataract is much, much worse on children than like adults, because we say that brain will learn the vision. It's like learning swimming. So the brain will learn vision until the age of 12. So anything in between this age, any interruption because of lens opacity or trauma, whatever, the brain would just forget how to see, and we will get lazy eye. So it's a different thing than like cataract, congenital cataract, different than like age-related cataract.
Right. Are monovision lenses an option?
Contact lenses or intraocular lenses?
I don't know.
Okay, let's say if we do have patient with myopic, he has negative power, let's say for instance, -3. And he touched down the 40s and he started to have issue with the near distance vision. So we do try to test the contact lenses, let's say contacting with monovision. It means everybody has a dominant eye and non-dominant eyes, like right-handed and left-handed. So what we do is we correct the dominant eye, which is meant to be for the far distance with full correction, and the non-dominant eye, we keep it a little bit under-corrected. So what I do, if I have patient wearing contact lens, I will test this monovision and see if the patient will accept it, and how far can we go with the monovision. So, and then if he accepts the monovision, it's a perfect solution, but it's also temporary for a couple of years. It will not last forever because this will increase with time. So if they do accept this monovision and they are happy with contact lenses, so we just continue with the contact. If not, if they say, I want to have visual correction, so we can do the laser treatment with this monovision as well.
Right, amazing. What are the lenses made of? Good question. I didn't never ask that question.
Let's say it's a silicone lens. It's complicated to be explained. But the main question from the patient comes in: do this lens last forever? We say yes, it lasts forever because we do implant it in babies, as you mentioned before, with congenital cataracts. So we do implant it in very, very young patients. And I will always say the lens will last at least 50, 60 years. But
wow,
it's forever, of course.
And we discussed whether if is my vision going to change? I know the lens is going to last that long, but could my vision change? I mean like it not be able to see as clearly as I can today.
Yeah, supposedly not. It should last forever. However, the studies of these lenses are not longer than 20 years.
Right.
Honestly. So the first lenses, they started to implant like multifocal, the first generation, I remember 2010 or 9 or 8, something around this time. So we don't have very long, like long-term or long-time study or like, let's say, statistics. So, but it should last forever. It's like, because we just removed the lens and implanted the lens. It's like having glasses without any other effect. So this is the theory.
Right. Okay. And who knows even what's going to happen in 10 or 20 years anyway. So, exactly. I mean, it's very really little point in asking that question. What can you have lenses inserted if you have astigmatism?
We do correct astigmatism as well. So in the case of laser vision correction, we can correct the astigmatism if we have regular astigmatism. Of course, we have to rule out any other disease in the cornea which caused the astigmatism. So we can correct it either with the laser or with the lenses. Like in your case, if patient, they do have astigmatism, so we can combine this. It's like customized lens. So we can correct the astigmatism as well. We call it the toric intraocular lens.
Wow. Amazing. You are based in Dubai at Moorfields. Do you practice anywhere else?
Myself, I mainly in Moorfields Dubai Hospital, right, in Dubai Healthcare City, and we do cover also King's College Hospital in Dubai Hills.
Right.
But okay, the surgeries are performed in Moorfields Eye Hospital.
Okay. Excellent. Well, thank you so much for giving me sight.
I'm happy to
and thank you.
Thank you
for joining me. Have a wonderful day, and I'll be seeing you again when I bring David in October.
Thank you very much. Enjoy your day. Have a good day.
Thank you. Bye.